Good morning, everyone. I'm Elise Memo, Director of Operations at Public Consulting Group and the California Path Collaborative Planning and Implementation, or CPI, Workstream Lead. Thank you, everyone, for joining us today for the California Path CPI Best Practices webinar titled Accelerating Improvement with the CalAIM CPI Best Practice and Sustainability Toolkits. I will turn it over to Lisa Bistrup from the DHCS team to get us started.
Good morning, everyone. Hello. My name is Lisa Bistrup. I am the Unit Chief of the PATH Unit within DHCS. We're excited to see all of you here today looking to learn strategies that support your engagement with CalAIM and the goal of improving the quality of life and health outcomes for our population. Today, I'm joined by my colleagues at DHCS, Michael Weezar, who is the Chief of the Managed Care Program Oversight Branch, and Jill Clayton. She is the Chief of our Project Coordination Section. Joining from our third-party administrator, Public Consulting Group, is Elise Memo, who just introduced herself. She is the CPI Workstream Lead, and Emilia Giacani, the CPI Collaborative Assistant. We are also excited today to have our speakers from HC2 Strategies, the Institute of Healthcare Improvement, Camden Coalition, and BPATH Health, four CPI facilitators who will be presenting our webinar today. Once again, thank you everyone for joining, and I'm looking forward to learning from you. I'm going to go ahead and pass back over to Elise.
Thank you, Lisa, and the DHCS team. Moving on to our agenda. Our agenda today includes an introduction to our CPI Best Practices webinar series, followed by a presentation on several of our best practice toolkits, then a highlight of our sustainability toolkit, including a live demo. We will then answer some audience Q&A and close out with final remarks and an evaluation poll. During today's webinar, we will drop all available links to resources discussed in the presentation into the chat, and they can be found in the resources section here on Zoom. The slides and a recording of today's event, along with a Q&A companion, will be posted on the CPI website several weeks following the webinar. As you listen to today's presentations, you can use the Q&A feature to submit questions to our presenters or CPI team. We will type in responses to some questions and address other relevant and common questions in the Q&A document posted after the event. In these twice yearly CPI best practice webinars, we aim to showcase effective strategies for implementing ECM and community supports, strengthen provider participation in CalAIM, and foster collaboration across organizations to deliver high-quality services for Medi-Cal members. Today's session marks the 7th webinar in our series. Recordings of previous webinars are available on ca-path.com. As with all our sessions, today's webinar highlights best practices identified through the CPI initiative. By the end of today's webinar, participants will be able to understand how the CalAIM CPI best practice toolkits were developed, what they contain, and how they support collaborative planning and implementation, understand how the best practices can strengthen local CPI implementation efforts, improve workflows, and support collaboration among stakeholders, explore examples and insights from providers that have used the toolkits and tips to avoid common pitfalls. I will pass it over to Emilia to share more about the CalAIM Path CPI initiative.
Thank you, Elise, and good morning. As noted, I will be providing an introduction to PATH and CPI. For those who may not be familiar, PATH stands for Providing Access and Transforming Health and is a 5-year initiative that is designed to support CBOs, hospitals, county agencies, and other key partners in successfully engaging with Medi-Cal members under CalAIM. PATH plays a critical role in supporting the statewide rollout of enhanced care management, also known as ECM, community supports, and services for justice-involved individuals. These services are aimed at equipping providers and local partners to deliver person-centered care to Medi-Cal members. To support CalAIM implementation, PATH is comprised of 4 work streams that provide targeted funding and resources. These work streams include Cited for infrastructure development, the TA marketplace for technical assistance, and justice-involved capacity building to support pre-release Medi-Cal processes. But today, our primary focus will be on the Collaborative Planning and Implementation Initiative, which is more commonly referred to as CPI. CPI brings together 26 collaboratives across the state and is coordinated by 9 facilitator groups that work directly with providers and stakeholders. Each collaborative functions at the county level, and collaboratives are designed to identify barriers, develop solutions, and enhance equitable access to ECM and community supports. Our facilitators are currently focused on building a program sustainability infrastructure and scaling best practices, such as the best practices that will be highlighted today to ensure long-term impacts of CalAIM. I'll now pass it back to Elise to give an overview of the best practices roadmap.
Thanks, Amelia. Content for the best practice toolkits was developed by CPI facilitators between 2023 and 2025. Throughout 2025, representatives from all 9 CPI facilitator organizations worked together to compile, refine, and prioritize the resources that became today's best practice toolkits. These toolkits highlight the resources that were considered to be the most useful by providers across the state. Each toolkit includes practical tools, templates, and guidance to help providers streamline operations and improve outcomes, with actionable insights, real-world examples, and tips to avoid common pitfalls. There are currently 2 best practice toolkits, the Provider Networking and Awareness Toolkit and the Referral Toolkit. All toolkits have been uploaded as PDFs to the PATH On-Demand Resource Library and the PATH CPI webpage in the Reference Materials section. Links will be shared in the chat. With that, I'm very pleased to introduce our speakers. We have Cheryl Mathis, who is the Senior Director of Care Redesign Initiative at Camden Coalition. Cheryl oversees an interdisciplinary team that works with regional partners to pilot and implement programming to support patients with complex health and social needs. Cheryl has led multiple technical assistant projects supporting community-based social care organizations in navigating the bridge with healthcare. Madison Olmstead is a senior manager at Blue Path Health. She serves as a facilitator for the Alameda PATH CPI Collaborative. Madison supports complex initiatives through policy analysis, project management, and cross-sector partnership development. Madison has experience in health policy and public health across nonprofit and government settings, including at the U.S. Centers for Disease Control and Prevention. I will turn it over to Cheryl to tell us more about the Provider Networking and Awareness Toolkit.
Thank you, Elise. The Provider Networking and Awareness Toolkit is organized into 3 sections, each offering practical guidance and key questions to support effective provider networking across organizations that provide services or refer clients to ECM and community supports. The aim of the toolkit is to help strengthen networking among ECM and community supports providers, as well as their referral partners. The Provider Toolkit is really designed to help ECM and community supports providers easily provide presentations that share key information about their services with partners, with community networks, and stakeholders. The customizable templates align with PATH success story requirements and streamlines the process of showcasing provider impact and promoting collaboration across the CalAIM ecosystem. The Provider Directories tool provides tips in getting started to build directories that facilitate more streamlined referrals and coordination by organizing key information about ECM and community supports and broader social services across a region. It provides examples of how consolidating data from multiple managed care plans can make it easier for providers, care coordinators, and community partners to connect eligible members with services. The system of care asset and networking map tools provide stakeholders with concise information about how to understand the components needed to create, update, and use an asset map. It also offers guidance on utilizing networking mapping to visually illustrate patterns of referrals, collaboration, and coordination within the care community. It can be used to depict relationships, referral pathways, and points of coordination among providers, agencies, and partners across the system of care. So how and when might these tools be useful? I can share one example. A county health and social services agency indicated that there were many new ECM and community supports providers serving the county since the launch of CalAIM. And it had been great for this to expand the capacity to serve eligible Medi-Cal members in the community, but it also created a challenge for understanding what services each organization was providing and what connections might exist between the organizations. So in this case, the enhanced provider directory and having access to provider spotlights has really been useful and very helpful in learning more about who's providing what services to whom. In the toolkit, we highlight multiple tools to support asset mapping and network mapping. The maps are generally organized by populations of focus, service type, geographic location, or a combination of the three. The mapping template from Camden Coalition follows an ecosystems framing, organized by areas of need within a community and the resources available to meet those needs. One example product from Health Begins that is included in the toolkit shows the output of asset mapping, organized by service type and geographic location for the Northeast region. It illustrates the geographic representation of providers by county in a map view and in a list view as ways to visualize and understand what organizations are providing ECM and community supports in that community. Multiple collaborative planning and implementation, or CPI groups, have been engaged in regional asset mapping and have similar products that are available as part of their CPI resources. In the toolkit, Camden Coalition and HC2 provide templates for asset mapping, and there are additional example outputs included from Population Health Innovation Lab and HC2 to illustrate some of the various ways that you can present the data.
Thank you, Cheryl. As Lise shared, my name is Madison Olmstead with Blue Path Health. We facilitate the Alameda and Tri-Counties Path CPI collaboratives. As previously mentioned, the Referral Best Practice Toolkit was developed in 2025 through collaboration among Path CPI facilitating organizations. We identified that across the state, community referral pathways were a priority area for innovation and tool creation. In several collaboratives, CalAIM providers have come together to develop tools to support growth of community referral pathways, since we know that strong referral strategies are key to sustainable enhanced care management and community supports programs. This toolkit brings these tested tools together from across the state to serve as really a one-stop shop for organizations that are seeking to advance their referral strategies in CalAIM. We built the toolkit to help users assess referral capacity, streamline referral workflows, and build effective partnerships. It is designed for enhanced care management and community supports providers who are interested in evaluating and strengthening their referral processes to increase their proportion of community-based referrals. There are 4 sections to the toolkit. The first is a self-assessment. So the self-assessment is a structured tool to evaluate current referral sources, identify gaps, and plan for strategic growth. It is a resource for organizations to review their own practices, opportunities, and gaps. Providers may use it to reflect on how well their current referral approaches match their service capacity, which referral sources may be promising areas for expansion, and what are the next steps that they can take as an organization. Next are referral cheat sheets. These are one-page reference tools that simplify the referral process with eligibility criteria, contact information, and step-by-step instructions. Organizations can customize these tools to help their staff and their partners better describe the services they offer using shared language. The toolkit also includes examples of standardized referral forms. These templates ensure consistent and complete referral information to help streamline processing and reduce delays. The toolkit includes examples from several counties who have implemented this approach as an option for referring providers and for their partners. Lastly, referral process maps are included as visual flowcharts that clarify referral workflows, roles, and decision points to support training and process improvement. Organizations can use this to document in detail how their referral process functions, resulting in a step-by-step diagram that they can use to train and inform their staff or to collaborate with external partners to build those referral pipelines. So one example of an organization who could use this tool might be a community supports provider that currently only receives referrals directly from their managed care plan. This is a really common starting point for many community supports providers, and often additional planning is needed to incorporate community referrals. The organization may have built up their capacity through Cited and the TA marketplace to accept more referrals than they currently receive, and they may need to identify new sources or build new workflows to increase that referral volume from the community. Next slide, please.
Thank
So
you.
if you're
Go ahead, Madison.
Okay. So if you're interested in digging into the ways your organization can boost community referrals for CalAIM resources, I would encourage you to download the toolkit and check out the resources that are in there. A really great way to start is to complete that CalAIM referral self-assessment collaboratively with your team. That way you can identify opportunities for your organization to expand referral sources and prioritize the next steps that you can take. Elise, I'll pass back to you.
Thank you. Thank you, Cheryl and Madison, for the overview of both of the toolkits, the provider networking and awareness and the referral toolkit. As we think about next steps, we have outlined a couple practical ways stakeholders on this call can begin applying these tools in their work. So for the provider networking and awareness toolkit, reach out to your region CPI collaborative and offer to present a provider spotlight at an upcoming convening. Include insights that could be helpful to other CalAIM providers and referring organizations, and take inventory of the provider directories available in your community and connect to your local 211 to identify any gaps in information or opportunities to enhance what's currently available. And for the referral toolkit, as Madison already said, working with your team to complete the CalAIM referral self-assessment to identify opportunities to expand and strengthen your organization's referral sources. Now we will transition to our sustainability toolkit presentation and demo from HC2 Strategies. I'm pleased to introduce Nignon Lewis, the Chief Transformation Officer at HC2 Strategies. Nignon is a nationally recognized expert in community-based quality improvement and multi-stakeholder coalition building. She leads efforts to build more equitable, community-centered health systems. Nignon is a former Institute for Healthcare Improvement VP of Population Health Equity and contributor to the landmark Triple AIM framework. Nignon serves as an advisor to major national initiatives with the Centers for Disease Control and Prevention, Robert Wood Johnson Foundation, and the U.S. Surgeon General. Nino, the floor is yours.
Thanks so much, Elise. And I'll apologize up front for my voice. I'm on the other side of a chest cold, but my voice is not on the other side yet. But I'm very happy to be here and I'm feeling great. So let's talk about sustainability today. To address, as a background, to address our sustainability priorities and path, we launched the Sustainability Work Group back in May 2025. And that was really to help advance the long-term impact of past CPI initiatives. And that work group really sought to answer two questions. What aspects of CalAIM are currently most effective that we're seeing and hearing in the field? And what strategies can help sustain those successful efforts as we continue on? As a result, we developed a working definition of sustainability, and we created a practical toolkit to support providers as well as community integrators. So today we're going to briefly share the definition of sustainability and introduce those toolkits and walk through them a little bit for you today and how to use it. So we drafted the following definition that you see on the slide, which guides our work on the ground throughout PATH collaboratives. You'll see that this definition expands the view of sustainability beyond some of the ways that we traditionally think about it, which tend to cover exclusively either financial sustainability or frame sustainability as merely just maintaining systems and programs exactly as they are. In this work, which we've come to know is more complex, it's adaptive, much more than just technical. We need to be thinking about the ability of organizations, not to just keep things as they are, but organizations and the broader Medi-Cal transformation ecosystem to maintain, to grow, to adapt, to scale effective implementation of ECM and community supports, even as circumstances change over time. So this framing of sustainability allows those working in both organizations and those working across sectors to understand broader aspects of programs and processes, including finances, but expanding into organizational capacity, programmatic and service delivery elements. You might be thinking about adapting to policy and changes in the broader environment in which your work occurs, infrastructure and capacity, the leadership and workforce considerations for your work, as well as those broader motivation and resilience to keep the work growing and adapting over time. So this broader definition of sustainability has really resonated with participants in our PATH collaboratives throughout the state. And we're continuing to learn what supports, tools, resources can accompany Medi-Cal implementers on the journey. Let's talk about sustainability at two different levels. I mentioned this briefly, but we really offer a framing for this type of more generative, dynamic sustainability. We think about it, both the planning and the implementation, at two levels. First, the provider or the organization level, sustaining the work to deliver your services as an organization. But you might also think about it at the CPI, the collective impact, the collaboration level, sustaining the work of collaboration and coordination across providers, MCPs, counties, and other partners to implement Medi-Cal transformation together in their communities. So we've developed a toolkit that speaks to both of these levels. And it was created to include a collection of really actionable planning and implementation tools to address multiple aspects of sustainability that I mentioned before. That could be your financial resources, the people involved, your programs and services, the outcomes of those programs and services, or the broader environmental context. Similar to the best practice toolkits that were featured today, the Sustainability Toolkit is live, and there'll be updated versions over the course of 2026. So you'll see in the toolkit, many of these tools will resonate both for providers as well as other organizations such as MCPs, strategizing both organizational sustainability in collaboration with providers and partners, as well, because we know that many of you guys are thinking about it in lots of different ways when you're thinking about sustainability. So let's actually walk through how to use the toolkit. So when you go to the PATH website, you'll see two parts of the toolkit. Let's consider your organization first and sort of a start with ourselves frame before you consider the network or the community level. So I recommend starting with this toolkit. These resources will help your individual organization assess the sustainability of your services from multiple vantage points, as I mentioned. It's a self-contained PDF, so when you click on it, it will open as a PDF that you can save. You can download it and you can start exploring. Let's walk through how you'd explore it. So we'll go to the next slide. And the step one, first is to just identify a need. At the beginning of the toolkit, you'll see a section overview, pictured on the right-hand side of this slide. You skim it and consider which of these categories best describe your needs. The 4 sections are resources, and that could be the extrinsic resources like finances, but it's also the intrinsic resources within us like motivation and joy in work. The change you're trying to make, meaning the skills for continuous improvement and adapting over time in your programs and services, could be the people that are involved, including the workforce and your leadership. And it could be the broader environment, those conditions outside your organization that affect your strategy every day. That could be technology or policy. We'll go to the next step, which is to browse by section, or you can search by keyword. So to get a glimpse of the breadth of the topics, you can browse through the sections. You could discover a tool that you didn't realize you needed. There's lots in here. You may also search by a keyword. If you know, I really want to focus on workforce, for example, as you can see here, we did a quick search and find for workforce, and it brought up all the different workforce related tools that you can see at your fingertips through this toolkit. Let's go to the next slide. In step 3, we'll identify a tool that speaks to your urgent questions. So recently, we've heard many ECM providers talk about needs for training staff, for example. So I reached for the CalAIM Coalition's excellent tool called Implementing the Complex Care Core Competencies Toolkit. When creating the toolkits, we selected all the tools that we could find, including this one, because they offer actionable resources, those worksheets, practical steps that you can adapt in your situation. If you ever need help applying or interpreting one of the tools, you should talk with your peers you've met in the CalAIM Path Collaboratives. I think others are also harvesting tools through these toolkits as they're moving forward in their work. In those networks, people are really generous in sharing what they've learned, so ask around. In addition to the toolkits and all the tools involved, each of the toolkits has a set of leadership reflection questions. Those are at the start of every section. You can use them to assess your needs, initiate planning conversations with your organization, and really guide the planning. We've seen folks use these as guidance for meetings, to design facilitated conversations, to guide client conversations. This is all part of how you would plan for sustainability over time. And one more bit of content that I want to mention is the tips and traps section. It's a quick set of actionable tips that you can take in as a quick advice of how to think about sustainability and how to use the toolkit. So that's also there in each of the sections. A quick reminder that there is also the community level sustainability part to the toolkit. And that contains tools that are used at the community level, not necessarily for individual organization within your organization, but those organizations that are working together. And that could be in an individual partnership with another organization. It could be in a loose network of multiple, or it could be in a formal coalition. It's structured similarly to the toolkit we just looked at, but with more discussion questions, tools, and tips at that community level. For example, we know recently the Current Path Collaborative used a set of reflection questions in the community toolkit to be the basis of strategy conversations in their recent in-person collaborative meeting. Finally, a call to action. So I'll end with this call to just start exploring it. Before using the toolkit, reflect to yourself, what does your organization need to address? Consider what would stop you from growing or reaching the clients who most need your services. Consider what threatens gains you may have made in the past few years. If you want a step-by-step guide to assessing sustainability for your organization, there's actually a sustainability checklist for organizations on page 6 of the Provider Organization Toolkit. It'll prompt you to consider organizational sustainability from all sorts of angles. Finally, we encourage you skim the tools. Some like a methodical approach. Others like to dive in and poke around and find something useful. Skim and see which resources connect with you. We're going to be updating the toolkits because we're seeing tools emerge from the Path Collaboratives over the course of this year as well. So stay tuned, and thanks so much for your time today. We're so excited to present all of this and get these toolkits in your hands.
Thank you so much to Mignon, Cheryl, and Madison for your presentations. And thank you to everyone who joined us today. We hope you're leaving with ideas you can apply in your local communities. We do have some time to address some of the questions submitted during the webinar. So I'm going to go ahead and pull some of those up. So first question is for Cheryl. Have the asset maps been created for all counties/regions, Or is this something that we should work with our local CPI collaborative with?
Thanks, Elise. I recommend working with your individual collaborative on that. While the asset maps have been created for many of the CPIs, there are different versions and different sort of scales and scopes of those across each region. So it would really be best to reach out to your own CPI to understand what's available there.
Thank you, Cheryl. One more question for you. Is it true that ECM is pretty well saturated? If so, why do we need the awareness toolkit?
Oh, that's such a great question. So I think if I'm understanding the saturation piece correctly, the networks certainly vary and have been well scaled up right across the state. However, as I spotlighted in the example of how you might use the networking toolkit, folks who are looking to connect with providers that are offering ECM and offering the other community supports are still looking to better understand who these organizations are, where can they find them, how can they connect with you all. And so I think from that perspective, it is very much going to be an ongoing need to continue to network, to continue to get the word out through spotlights and other sorts of activities to let folks know what services organizations are providing within the range of CalAIM benefits and supports that are available.
Thank you, Cheryl. Nignon, we have a question for you that was brought up when slide 27 was up, which was the sharing the Camden Coalition implementing the complex care core competencies toolkit. And the question was, can you provide some examples of, quote, better way to coordinate care?
Sorry, I was speaking on mute. In the toolkit, when you go to the program level sustainability for organizations, you can see there's pieces around your own organization assessing coordination, how well you're working through referrals. It refers back to some of the tools and some of the other best practice toolkits as well. And then in the community toolkit, there's much more around coordination and collaboration in terms of engaging the right partners in the coordination, figuring out where there's shared alignment of strategy, how you might convene new partnerships together. How do you even assess what partnerships are out there to coordinate care? So there's multiple levels of coordination that happen, and they're both in the organizational toolkit as well as the community level toolkit. Hopefully this is helpful.
Thank you, Nignon, for the clarification. A question for Madison. Our organization has been providing services for a long time now, and we have established workflows and processes in place. How might these best practice toolkits be useful to seasoned providers or well-established organizations?
I love that question. I think that the toolkit is a great opportunity to take a step back and assess how your organization is doing its work. Think about what's been working well, and identify where your next area for expansion and improvement is as an organization, especially going into the end of 2026. So for this type of organization, I would definitely recommend taking a look at that self-assessment. I think it works well for organizations that are very deep in this work already, because it has that opportunity to reflect and identify areas for expansion. So I would definitely check that out. And then I think that the fourth tool in the toolkit to create a workflow diagram, if an organization doesn't have that already, I think if you have flows that are working really well, being able to have them well documented for when you bring on new staff is a great resource too.
Thank you, Madison. Another question for Nignon. You mentioned a provider sustainability checklist. Can you talk a little bit about what is on the checklist and what kinds of things might be included for an organization to consider?
Yes, so the provider checklist will start to look at your own individual organization's capacity, your ability to turn leads into clients and client volume optimization. You might be looking at your specific workforce and whether you've got the right folks to deliver for your clients. So it gets into a little bit of the nittier, grittier pieces of how are we sustaining our ability to deliver services. It's right in the front page of the provider organization toolkit after you get past the introduction. I invite you to poke around. You don't have to take all of the questions in that checklist. I invite you to look at the ones that feel most relevant to you. But I think that it's a great way to, in some ways, we don't always know what we don't know. And so this is a collection of what we've seen from providers as you're starting to plan of how you better deliver services and scale and grow those services over time.
Thank you, Nignon. I also saw a question asking about our process for continuing to update these toolkits and then what will happen with the toolkits once PATH ends. As we know, it is ending at the end of this calendar year, December 31st, 2026. Great question, and just wanted to address it here. We do continue to go through an iterative process of checking the resources periodically and updating them, and then updating them on the toolkit. And that's going to be going on through the rest of 2026. Nignon also mentioned we are working on some updates for a version 2 of our sustainability toolkit. So we will be probably launching that sometime in calendar year Q3 of 2026. And we are actively also working with DHCS on a post-PATH transition plan. So those are active discussions that are happening, and we'll share more when we have more information. I think that we have come to the end of our questions. So we really appreciate your engagement. Any remaining questions will be compiled into a Q&A document and posted along with the slides and webinar recording on the CPI website after today's session. And I'm now going to turn it over to Amelia to close out today's webinar.
Thank you again for your time today. If you haven't already, we hope that you will join a CPI collaborative in your region. The registration link is in the chat now. And please stay tuned for announcements of the next CPI Best Practices webinar, which will take place in the fall of 2026. On behalf of DHCS and the PCG CPI team, we greatly appreciate your participation in today's webinar and hope to see you again during our next Best Practices webinar in fall 2026. Thank you again.